Daniel Gaffney with MD Western Orthopedics in Omaha, Nebraska. Thanks for joining our hand surgery webinar tonight. The subject of the webinar tonight is wide awake hand surgery and its impact on hand surgery here and across the world. I'd like to welcome everyone for joining us here tonight. Thank you so much. And this will be recorded and it will be placed up on our website for future people to visit and view. If there are questions during the course of the webinar, please put your questions into the chat and we'll have a interactive Q&A at the end of the talk. So without further ado, let's get started. Well, our agenda tonight is to discuss some of the topics related to wide awake hand surgery. So this has become a very popular topic among hand surgeons, both in the United States and abroad, because of its diverse impacts on our healthcare systems. This impacts the healthcare costs, both as a system and to the individuals. It has impacts the surgical costs to hospitals and clinics. We'll go over the economics of wide awake hand surgery and the acronym of WALANT or WALANT. W-A-L-A-N-T is actually an acronym for wide awake local anesthetic no tourniquet. So a very specific technique of wide awake hand surgery. We'll talk about who is a candidate for wide awake hand surgery and the types of surgery we can perform wide awake, and the benefits and the outcomes, and then we'll get to our live Q&A. But first, a little bit of the economics. So the impact economically of doing hand surgery wide awake is pretty tremendous. Hand surgery done wide awake without an anesthesiologist involved, just under a local anesthetic in a clinic or procedure room setting is dramatically less expensive than a surgery performed with anesthesia and in a facility where facility fees can be charged. But this really impacts the personal in that medical bills are the leading cause of bankruptcy in the United States today. And as of 2018, over 1 in 5 Americans had medical debt. That number seems to just be rising year after year. Such a huge impact on our own personal finances. And this is a great way to help alleviate that impact. Wide awake hand surgery also reduces the amount of medical waste. Medical waste is estimated, and I believe these are either 2014 or 2018 numbers, to generate 254 million tons of waste paper per year just in the US alone. 4.6 pounds of waste per person per day. And medical waste is about 33 pounds per day for each staffed bed per hospital in the United States. And it's estimated that the surgery department produces about 40% of this medical waste. Well, is there a better way? WALANT, or wide awake local anesthesia with no tourniquet, provides similar outcomes and lower cost and dramatically less waste. So here's the acronym again: wide awake. So there's no mind-altering medicines involved. Local anesthesia, so we inject local anesthetic at the surgical site. No tourniquet, so there's no pain from a tourniquet applied to the upper arm or lower arm to prevent bleeding, because the local anesthetic does that job for you. That also means no pain associated with the tourniquet and no lack of blood flow to the limb during the time that the tourniquet's on. Sorry, we're having some technical difficulties. There we go. Because of all these wonderful upsides, it's become a big popular trend in hand surgery over the past several years. And some of the upsides are eliminating any side effects or risk of anesthesia, It eliminates the long wait time before the surgery, as well as the long time in the recovery room after the surgery. And it does not require any pre-surgical fasting. It does not require any pre-surgical testing or clearance. So some of the available procedures to be performed under a wide-awake local anesthetic, typically surgeries involving tendons. So tenolysis is freeing up a scarred tendon from surrounding scar tissue. Some other tendon release type surgeries, such as a de Quervain's release or a trigger finger release or a Dupuytren's release, all of these are great options to be performed under a wide-awake local anesthetic. In the setting of trauma, where there are cut tendons, performing tendon repair surgery is one of my favorite things to do under a wide-awake local anesthetic, because it offers both surgeon and patient alike to actually see the tendon repair working and to test the tendon repair. If it holds up to active motion in the operating room, you know it will hold up to active motion during the rehabilitation process. Tendon transfer surgery is an excellent option under wide-awake local anesthetic. We can fix many different kinds of fractures under a local anesthetic. Carpal tunnel surgery can be done under a local anesthetic, and some arthritis surgeries can be done as well as cubital tunnel release. Now, there are patient-specific factors that may make this possible or not possible in any given patient, and it's definitely up to the surgeon's discretion. The last page and this page both have pictures of the technique of injecting the local anesthetic. So on the day of a wide-awake local anesthetic, no tourniquet procedure, your surgeon will meet you in the preoperative surgical holding area. They'll confirm the operation to be done and mark their surgical site. Then the local anesthetic will be injected typically in the preoperative area. The technique is very specific, as in the last slide, that the needle enters the skin at a 90-degree angle to the skin so that it's not going through any excess amount of nerves, and it goes completely beneath the skin into the subcutaneous tissue. We inject very slowly with a very special preparation of local anesthetic with a bicarbonate buffer that also has epinephrine in it. The epinephrine decreases the bleeding at the time of surgery and lengthens the time that the anesthesia is working in the system. We inject very slowly, as the speed in which the medicine enters the system impacts how much it hurts as well. And we use large volumes. We inject large volumes of local anesthetic to both ensure that the patient will be pain-free during the procedure, that the anesthesia will last throughout the procedure, and that it will provide some postoperative pain relief as well. The large volume also decreases the risks of bleeding at the time of the surgery. As we inject the anesthesia into new areas, we make sure and inject anesthetic in front of the tip of the needle, with the goal being that after the first poke, patients shouldn't feel any more pokes during the procedure of injecting the local anesthetic. Following the injection of the anesthetic, we usually give several minutes to allow for the anesthesia to take effect. These pictures depict goals of where we would inject our local anesthetic for carpal tunnel release surgery. On picture number A, the two little purple dots indicate the two places where the needle would puncture the skin. On picture B, the anesthetic has been injected into the dot further out into the hand. You can already see the whitening of the skin where the anesthesia is having its effect. On picture C, there's an even greater anesthetic effect, and you can see just how much volume has been injected underneath the skin. Following this injection, the patient is allowed to sit for several minutes, sometimes even 30 minutes or more, to make sure that the anesthetic and the epinephrine have their full effect. At that point, the person is brought back to the operating room. Often you're allowed to walk back to the operating room because you're wide awake. You don't have an IV typically, and you've had no mind-altering medicines to make you unable to walk. When you get back to the operating room, the hand, or if you're doing the procedure in the clinic, the hand is sterilely prepped and draped. The procedure is performed, and the patient can even view and interact with the surgeon and the assistants during the operation. If there are fractures fixed or tendons repaired, we ask the patient to move their hand, demonstrate, hey, can you close? Can you open your hand? Are things moving? Are things functioning right? It gives both patient and doctor great reassurance that about the strength of any repairs performed, and gives the patient the opportunity to see the inside of their body. To see a tendon moving is really a tremendous experience for the right person. If you're squeamish or are not interested in looking at things, it's not mandatory. You don't have to look. Following the completion of the procedure, the skin is closed in a routine fashion, and dressings are applied, and you're ready to go home. It's just that quick, no time spent in recovery, no nausea, no vomiting, no other side effects afterwards. And the local anesthetic will typically stick around for at least 3 hours from the time injected, longer if a longer acting anesthetic is used. Getting back to some of the economics, we know that this can save hundreds just in supplies alone for a single case. All the excess materials of surgical drapes and basins, suction and cautery, warming devices like a bear hugger, TED hose to squeeze on legs to prevent blood clots that aren't going to happen because the person's wide awake and they can move their legs, or sequential compression devices. None of these are required during wide awake local anesthetic. And all these savings don't take into account any of the pre-surgical testing or the anesthesia costs. These are 2014 numbers, but anesthesia is not an inexpensive thing. I love my anesthesiologists. They do wonderful work. They alleviate anxiety, they alleviate pain, they allow us to do more invasive surgery that we never could do without it. But for surgery that doesn't require a general anesthetic, local anesthesia is much safer and much less expensive. Additionally, the preoperative testing, although these are numbers from a 2014 study, in more current studies and in some markets, preoperative testing for $1,000 to $1,300 on average, and that's a big savings both for the healthcare system as well as for the individual. So, returning to some of the many benefits, you avoid anesthesia risks and complications. You have a faster return to normal the same day. There's virtually no time in the PACU or the recovery room. You just change your clothes and go home, or if the procedure is done in the office, you don't even have to change. You just go home. Typically, there's no IV required for many of these procedures, although some still require an IV for some antibiotics. And people are able to drive themselves to and from the operation, typically saving time for friends or family members who may have had to take time off of work to transport patients. There's typically no pre-surgical fasting, pre-surgical workup, and we're able to test our repairs and confirm how stable things are. Another thing I like a lot about wide awake local anesthetic with no tourniquet is the opportunity to interact with the patient. While we're performing the procedure, we can educate the patient on what to expect after surgery, what their rehabilitation may look like, what their activity restrictions may be, what to expect with regards to numbness or tingling or pain, and then more of their long-term outcomes. It's a great chance to bond doctor and patient, and a great chance for the patient to learn more about their condition and what to expect in the days and weeks to come. Patients really enjoy this as well. If it's in an operating room, oftentimes there's music playing. Patient always gets to pick the music, so it's kind of fun for them. I think we went into the decreased waste, lower cost to patient and society, less time off of work, both for the patient and for family, And it's more efficient for the surgeon if we're able to do operations in the clinic during normal office hours rather than having to transition to the setting of the operating room. It makes things very convenient for all involved. So I'd like to thank you for joining us tonight, and we will get to the Q&A section. Really appreciate your attention. Great. So we've got some great questions in the chat. I'll start with those. First from Spencer. For carpal tunnel wide awake surgery, how soon can I go back to work if I work on a computer or in an office all day? So some patients are able to return to work the following day. I think that's a little bit aggressive. Oftentimes taking 2 or 3 days, perhaps a weekend or a little bit of a long weekend should be enough to get it back to work. Now, it's not like you're pain-free. You won't be as fast or efficient on a keyboard or a phone or a mouse as you were before the surgery, but it shouldn't be dangerous to return to work in that short a period of time. If you have to do more heavy manual labor, it may be 4 or 6 weeks, occasionally even longer, to getting back to doing that. Next, are there any age restrictions? There's no specific age restrictions, but I think Spencer's question begs a bigger question. Who is this right for? You know, for most adults who aren't overly anxious about the whole idea of local anesthetic or have fear of needles, it's right for most adults. When you look retrospectively at people who have decided to proceed with wide awake surgery, it's 85 to 95% of them say absolutely without a doubt they would do it that way again. I think people mostly will self-select that if the idea of wide awake surgery seems like something that they would not experience, then it's probably not the right thing for you. And for children, it's very child specific, so there's not a specific age restriction. I've done wide awake surgery in children as young as about 5, but there's some, teenagers and grown-ups that wide awake hand surgery may not be good for. Pam brings up a question about contraindications for those patients on blood thinners. Great question. So oftentimes, bigger surgeries require people to come off of their blood thinners, but for most wide awake hand surgeries, think things like carpal tunnel release surgery, trigger finger surgery, de Quervain surgery, those we don't have to bring people off of their blood thinners, put them at risk for blood clots or strokes. Just keep taking the blood thinners straight through, and we've shown that maybe there's a very minimal increased risk in hematoma formation, but not a substantial enough increased risk to justify coming off the blood thinners. So typically we'll operate right through those problems. And from Shaylee, what's our general feedback from patients who have had wide awake hand surgery? I take a special moment to ask virtually everyone who goes through this about their experience. Would you do it again? And my experience has been similar to the literature that almost everyone would choose to do it wide awake again. I also have a brother-in-law who's a dentist, and I always like to ask, hey, which one would you rather do? Go to the dentist or do this surgery again? And it's pretty similar that almost everyone says, wow, that was not even as bad as having an injection at the dentist. Another question, how often are we doing wide awake hand surgery? I mean, we do it every week. So we have a busy practice here at MD West One Orthopedics, and we do a lot of hand surgery. And every week, I would say, we're doing surgery wide awake on the hand. Oh, it's so nice to see all these questions and have this fun interaction. Oh, Pam's got all the best questions tonight. So do we see less pain medication after surgery? Um, I would say yes. I don't have my own personal data collected on this, but we're seeing that maybe 50% of people after a carpal tunnel release surgery are only taking Tylenol or ibuprofen, and even then, it's only for a day or two. And that people, once counseled on what to expect and going through the whole experience of wide awake hand surgery, I think we have seen quite a bit of a lesser need for narcotic pain medicine afterwards. And I think we're all very well aware of the opiate crisis ongoing in America today. This is just one little piece trying to counter that, that if you're not needing to prescribe narcotic pain medicines for your wide awake hand surgery, there's just less narcotics out there in the system. Right. So if patients have anxiety, do we prescribe any meds for them during the procedure? It's very much on a case-by-case basis. Occasionally, there's a person who just needs a little bit of relaxation, a little bit of help. As long as they have a driver to bring them to and from the procedure, a light anxiolytic anxiety medication is a real reasonable option. If there is a concern that people may be more anxious, then proceeding with a more invasive anesthetic plan, either a moderate sedation or a general anesthetic is a better option. But for people who are familiar with an anxiolytic such as Valium, something like that, and have had good results from it, yeah, we've definitely done that. And so I prefer to perform wide awake hand surgery in the office if we're able to. There's some procedures that are more safely performed in an operating room where you have the better light, the better instruments, and perhaps some instruments that we can't use in the office. So if we can, I prefer to perform many wide awake hand surgeries in the office, but there are some that just require instruments or implements that we can't use in the office. So we try to shoot for the most appropriate venue for the surgery. And then from Kathy Ramaker, do you feel that clients who select wide awake hand surgery are more involved in their post-surgery recommendations and with hand therapy? Absolutely. I think that time spent discussing post-operative rehab and experiencing this together as a team, I think they really understand that recovery following, especially tendon repairs, is a real team sport where patient, surgeon, and therapist are all of huge import. And spending that time discussing what does rehabilitation look like afterwards, and what can it look like if you're not able to do the postoperative rehab, what will it look like if you disregard the recommended restrictions after surgery, and to experience what the repairs look like. I think it definitely builds patient confidence in the whole system and in the team of surgeon, therapist, and patient. I almost feel like I'm playing hand therapist during wide awake hand surgery at times, because I get to have a longer interaction with the patient and coach them on recovery afterwards. As surgeons, oftentimes our interactions with patients are brief, just in the office and then in surgery. Office visits have gotten cut so short these days, but it's really an enjoyable experience to be able to spend some more time talking about recovery afterwards during the wide awake hand surgery. It's usually longer than the brief office visit we're allotted. And I've been doing wide awake hand surgery here in Omaha ever since I started practice about 8 years ago. Was trained on that during hand fellowship as well as during my residency. Did my hand fellowship at Wake Forest University in Winston-Salem, North Carolina, and my orthopedic surgery residency at the University of Utah in Salt Lake City. And I love getting these questions. I love trying to answer and having this nice interaction with everyone out in cyberspace. Well, hopefully I've answered people's questions. A wide awake hand surgery. I know this wasn't specific to one specific disease or procedure or condition, and more of a general approach to the treatment of disease in a cost-effective and appropriate level of care, as well as decreasing medical waste and improving patient satisfaction and really improving patient outcomes and saving money. It just hits all the important aims in healthcare today to trying to make healthcare more sustainable and get better outcomes for our patients and a more pleasant experience as well. And from Mr. Bill Koch, yes, definitely this is becoming standard for our less invasive hand surgeries. I think that if you're not being offered a wide awake option for many of these things, that it's almost a disservice. It's not the right thing for everyone, and not every surgeon's comfortable with it, of course. But for many of these procedures, it should be the standard of care because it is so much safer and so much less expensive. And just and as Ms. Shaylee McKeever brings up, this will be recorded, and we'll be able to share this with our guests who joined us tonight. All right. Well, it's been a quick 27 minutes. I hope you all enjoyed. I hope you've learned something. If there are further questions, you can contact us at mdwest1.com. It's been great talking to you tonight. Thank you so much.